at that forecast. With more and more effective treatments in skincare and rejuvenation, the latest is something called a liquid facelift done with injections and not surgery. Dr. Sam Shatkin Jr. is back from the Aesthetic Associates with all the details and pictures. And your Kathy is such a good sport.
Well, yeah,
we have to show you the picture. Kathy is Doctor's assistant. She's a nurse, and she was willing. She said, all right, go for it. Now, this is Kathy on the left before anything, and take a look at Kathy on the right, and you'll definitely see improvement around the mouth, certainly around the eyes. Her skin just looks fresher, and we're going to find out how this was achieved, and we'll even take your calls at 644-9840. So welcome back, sir.
Yeah, good to be back.
Did you have a good Fourth?
Oh, it was great.
All right,
yeah,
excellent.
Very nice, very nice.
Kathy looks fabulous.
Yeah, well, you know what? She always looks good.
Yeah, she does.
One of the things that we're able to accomplish now, which we've been doing for many years, but we're starting to combine the modalities of things that we do and get the best possible result. And the way we can do that is try to maximize the daily skincare at home. And then when they come to the office, we can do what I call the liquid facelift, the liquid lift. We can fill the areas of depression, soften the lines, reduce the contraction of the muscles, you know, with Botox, and make a beautiful difference without any downtime. And
you know, it's very subtle. You look more refreshed. It looks like you got a great night's sleep. You look better, but it's not where someone's going to say, hey, you had something,
right,
you know?
Right. Well, you don't want that. But
you don't
the thing
want
is,
that, right.
If they've got a small amount of looseness to the skin and starting to show those aging changes, this is perfect. If, on the other hand, they've got a lot of loose skin that's many, many years, or bad sun damage and things, you need more than just a filler to soften and improve the appearance. But a lot of people are tired of looking tired, and that's what this can do for them. All
right, now we're looking at Kathy's pictures now, and you're seeing exactly what all these products can do.
Yeah.
Now, in a course of how many treatments or visits did Kathy get this done?
One treatment.
Really?
One day, one visit.
Day?
One day, one visit. The whole thing takes about maybe half an hour, 45 minutes. We put some topical on there first to numb up the area, and then we do the injections, and this is basically a typical syringe that we might use. I don't know if we can get a close-up of that. This is the syringe.
Just hold it right there.
And it's you know, white in appearance, but when it gets underneath the skin, it sort of develops the normal texture of the skin, and it softens up the lines, and it's just great. And we use a tiny little needle, and the patients don't seem to be bothered by it.
And how long would this result last?
Well, there's different products, but the radius is more than a year. The FDA says we can promote it as more than a year. Juvederm lasts up to a year, they say. Botox, it's usually 3 times a year the patients will come in for that treatment, but that's a treatment to relax the muscles, paralyze the muscles that are causing the tired look or the angry look. So
hand me over the Botox picture, because I want to show people that you don't use, let's say, Juvederm or Botox for the same thing. You can't use one product on all of this. And here's why.
Let me explain that then. This is a good, if we can zoom in on this, this is Botox and the treatment of Botox, but Botox helps dynamic lines that are created when we're animating. On the other hand, the things we talked about a moment ago were the fillers. Those are to soften lines that are when you're in repose, when you're relaxed. Those are static lines. So if you've got a combination, and most people do, and Kathy did, all right, I hope she's not upset that I say this, but you know, then they need a combination of both. Right. And it really works great, and that's what I was telling you about in the beginning.
Some of the furrow lines can be genetic. I mean, if your parents all, you know,
well, if you've got strong muscles there, or you're in a profession that you have to animate a lot, or like you're a teacher, for example, and you're aggravated by kids, or a mom even, you know, then you might
make that face.
You might develop those lines sooner than others, but they're all going to happen because lines on the face are related to muscle action. That's why we get them. So.
Right. Okay, but take a look at Kathy's lines around her mouth in the before. Well, here we go. Now,
here, the
these
smile
can be,
lines.
Here they are. And everybody develops them later in life.
And you can see how they're nicely softened after the
Take a look.
This is the after. And the other thing too is when we talk about fillers, the face does deflate as we get older. The hyaluronic acid that's inside the tissues starts to lose its potentiation, lose its volume over many, many years from estrogen changes from the women and from sun damage and radiation exposures and all these things that affect our body. They start to change, and that's exactly why we need to refill the face. Okay, so if you'd like, give us a call at 644-9840, and we can talk more about some really interesting products. Well, you know, we've talked about our skin products, the Smooth and Natural system. We're coming out with a new skincare line that's going to be very, very soon, probably next month or so. And this is one of those liquid facelifts. It's an anti-wrinkle cream. We've incorporated some gold into the product, some minerals that'll help the absorption of the ingredients that we have in this. And this is just the smoothest gel that you ever want to feel. I'll give you a little touch of it. You can see the gold in there.
Yeah, that does come out.
And then it slowly absorbs into your tissues, and it just.
Now, would you put this on in the morning, at night?
Yeah, well, it's either
Oh,
either
it's nice.
or. It's either or. It's very, very gentle, very mild.
Save some for this hand.
You can have. You know.
Well, you know, it's interesting because I see that you're working the skin off from both sides. We have the glycolic acid. You have the smooth and natural, which is for the outside to keep everything clear on the outside.
The liquid peels on the outside.
Keep all the dead skin cells from staying on the surface. You want to get rid of those. And that the filler will help from the inside. So it's a two-part kind of thing.
Well, you know, my brother being a dentist, I always make this example to my patients. They don't just go to the dentist 2 or 3 times a year and just get their teeth cleaned and never care about their teeth the rest of the year. You do it on a daily basis. Same thing with your skin. Your skin is the largest organ in your body. Why would you not want to take care of it? It defends your body, it protects your body, and it's what people see for the most part. So you need to treat it properly, and we use these liquid products, the liquid facelift type products, to get you the best results.
And you know, the skin will also reflect how you've lived.
Right.
If you're a smoker, you're probably going to get lines much sooner. If you're taking in too much alcohol, the face
diet is very important.
Diet.
You've heard me talk about that before. All these things are so critical to getting the best look.
Right, and you also counsel people on their general health on keeping, you know, good things going in if you want to radiate goodness coming out.
Well, if I don't have patients that want to be healthy, then the surgery is not the answer. It's a two-way street, basically.
Right, absolutely. All right, 644-9840 if you have a question about any of these. And I know an awful lot of women, but also men will come in and have this done too.
Well, the nice thing about, exactly. I'm glad you brought that up, because the nice thing about the men coming in is they don't want to have the surgeries. Some of them are working, not that the women aren't, but they really can't take any downtime to come in and have surgery and then recover. So we'll do the fillers, we'll do the Botox, we do the laser treatments, we do the chemical peels in the office. All of these things will help rejuvenate these individuals without any downtime or almost very little downtime. And that's what people want. You know, sometimes it's no more than a day or so, or no downtime at all. They'll come on their lunch break. These are like lunchtime facelifts, basically. I
think it's wonderful that there are people who have just had something perhaps and it shows on their face that they're just not happy with, or they've been hiding it with hair, or they're trying to do something. You don't need to anymore. It's like having a mole removed. You can go and take care of this now with a minimum of fuss, and you're going to love the result, and it's going to make you happy. And that's the important thing. You want the face on the outside to reflect who you are on the inside.
Yeah, exactly. Well, if you don't like the way you look, if there's something that bothers you about your appearance, then what you need to do is come into our office and let us show you what we can do. We have so many different options, surgical, non-surgical. You know, what I do mostly is the surgical component, but a lot of these skin treatments, the lasers and things, I have a wonderful staff that's there to help it.
Yeah, and it's amazing how really the difference that you really do see. I mean, that's an amazing result from these products.
With 1 hour treatment in and out of the office, and they can be relaxed then.
Yeah, that's great. And remember, some of you folks still have that cosmetic rider, so by all means ask the doctor about that.
Some insurances do cover this, right?
Yeah, so, you know, don't be afraid to ask. But really, no matter what you're going in for, the doctor has seen it all, heard it all. Go on in and make yourself happy, and that's what it's all about, and that's what the Aesthetic Associates do for you. We have Dr. Todd Shatkin, Dr. Sam Jr., Dr. Sam Sr., and a wonderful staff there at 2500 Kensington Avenue in Amherst. Do give them a call about something you've seen today or something you've seen in the past. 839-1700, 839-1700. And this was brought to you by Dr. Sam Shatkin and Great Look Monday.